So classes on Wednesdays are not from the textbook. These are just additional classes, just to make you understand certain concepts of medical terminologies, to understand the meaning of certain medical terminologies, disease conditions, how it happens, why it happens. Okay, what are the treatment options? We'll not go in detail about the treatment, but diet-based management. Okay. So osteoporosis, it causes your bones to become weak and brittle, and so brittle that even if you fall or slip or trip, okay, or even bend your legs, okay, so even in such cases, it can lead to a fracture, it can cause a break, even cuffing in severe cases. If you if you lift something very heavy, cuff, okay, or even just trip and fall, bend your ankles, that can also lead to a fracture. Your own body weight can also lead to fracture. That is osteoporosis. Okay, and it commonly happens, these kind of fractures or break, it will commonly happen in the hip region, wrist region, spine. Okay, these are the most common areas for breakage due to osteoporosis. So bone is also a living tissue in your body, which is constantly under breakdown, and it is being replaced. Okay, bone minerals, they are taken away by osteoblast will come there, prepare a new matrix, prepare the new osteoid, and then new bone will be formed. This is a cycle, it goes on and on. But when you get older and older, the breakdown is happening at the same pace, but the replacement of the broken down area of the bone, to be replaced by the new bone tissue, that slows down. Okay, so it happens as a part of your aging process. And along with that, if you're not having a good mineral rich diet, this replacement is even more slowed down. And that's how osteoporosis takes place. Because you are at a regular pace, you are losing the minerals, but there is no way to replace those minerals back at the same speed. Okay, so that creates a disbalance. That creates these hollow pockets in the bone tissue, which we call as osteoporosis. Okay, normal bone, how it is dense, how it is mineralized. If you compare that with the bone which has osteoporosis, you can see these so many empty pockets. Okay, because of the loss of bone minerals from there. It affects men and women and everyone of all races. Okay, but usually white and Asian women after menopause, they are at the highest risk. Even South Asians, Indian women also come under this category. Okay, white women and Asian women. It does not affect much in Africans, but Caucasians and Asians, especially women, after hitting menopause, they are at a highest risk of getting osteoporosis. So, what are the symptoms of osteoporosis? In early stages, you will not find any bone loss. Okay, this is your mid 30s, early 40s. You will not see much symptoms here. Okay, but once your bones get weakened over a period of time, slowly certain signs and symptoms start showing up. Okay, like your back pain, having lower back pain, and all. Either it is because of small breaks, collapsed bone, slip disc, and all these things. Okay, loss of height over time. There is a bend that comes in the spinal cord. Okay, women who after the age of 70s and 80s, you see them, they are bended, they stoop down. Okay, their posture is stooped down, and even the height reduces over time. and that is also because of the lack of bone density. Stooped posture. You can see here an image of a woman who has a stooped posture, bent down posture. Okay. And these bones, they break more easily than expected. Okay. So these all are the usual symptoms of osteoporosis. Coming to causes, as I have mentioned earlier, your bones are in a constant state of renewal. New bone is made, old bone is broken down. Okay, so when you are young, your body makes new bone at a much faster rate than it is than it breaks down. Okay, so that's why children grow. Even in children's body, bone demineralization is taking place. But the way how bone mineralization takes place is at a much faster rate. That's why bones grow in length and children grow in height. Okay. But when you age, it becomes the opposite. Okay. Demineralization is at a much faster pace as compared to mineralization. That's how you lose your bone mass. After early 20s, this process slows down, especially in women. Okay, by the age of 30, the bone mass that you have gained, okay, your peak bone mass is around the age of 30. Okay, so as people age, bone mass is lost at a very faster rate. After 30s, it is accelerated, especially for women. Okay, how likely you are to develop osteoporosis depends how much bone mass you have attained in your youth. Okay, so based on your diet, your lifestyle, okay, your exercise routines and everything, strength training exercises and all, that determines during your youth, okay, by the age of 30, it determines how strong your bones are, how how peaked, how much you have attained peak in mineralizing your bone. Okay, and also your inheritance also varies based on your ethnic group. If you are from a African ethnicity, Black American ethnicity, okay, generally they have better bone mass as compared to other races. Okay, the higher you peak bone mass, the more and a better mineralized bones you have by your 30s. Okay, you have enough bone mass that will last you for a pretty long time, and you may not develop osteoporosis sooner. Okay, it certs at a certain age osteoporosis will kick in. Okay, in 80s, 70s and all, but it is much delayed because you have enough amount of minerals in your bone. It's kind of a bank balance. Okay, it's a that you already have, which you can on which you can flourish for the next few decades. Okay, risk factors. There are risk factors which are unchangeable, like your age, your gender, okay, and certain risk factors which you can change. So, unchangeable risk factor, it's first one is your sex, gender, okay, which you cannot change. Second is your age. The older you get, the you will have increased risk of developing osteoporosis. Again, aging process you cannot change. And sex also in women are at a higher risk as compared to men in developing osteoporosis. Race, if you are Caucasian, white, or of Asian descent, you have an increased risk. Family history, grandparents, parents, siblings are suffering from osteoporosis, you also have a risk of developing it. Or you can see what kind of fractures your parents have, they may have had, both parents, mother and father both, what kind of fractures they might have had since childhood, during adolescence and their youth. Okay, so that can also determine what is your risk of developing osteoporosis. Body frame size, men and women who have small body frames, less height, not that wide. Okay, when we talk about body frame, it's not about your weight. Okay, it's about if you stand next to somebody else, any stranger or with your family. Okay, how do people perceive you? Does people see you as a big person of a substantial height and weight, or they see you as a petite person? Okay, petite woman, petite person, somebody who is not that high and they are also not that wide. Okay, in body frame, their shoulders and all, it's not that wide, it's all lean, narrow, small heighted person. Okay, so those is what we call as body frame, small body frame, or petite body frame. They also tend to have higher risk because usually it's understood that they have less bone mass as compared to uh, people who have broad shoulders. Okay, they have a good, more than average height. Usually in India, if a man is above 5 feet 11 inch or around 6 feet, they have good, they usually will have a good uh, bone bank balance. Okay. Women also, if they are above the height of 5 feet 3 inch or 5 feet 2 inch in India, average height for women, if they are more than 5 feet 2 inch, generally they will have a better bone structure and bone mass as compared to the average Indian woman. So osteoporosis, based on hormone levels, your hormones also controls the amount of minerals your bone will have. Okay, for example, parathyroid hormone, thyroid hormone, calcitonin hormone, these are the hormones that control the calcium levels in your body. Okay, so hormones also have a role to play in determining the occurrence of osteoporosis. Okay, for example, sex hormones. If you have low sex hormones like estrogen in women, okay, and testosterone in men, if your body is not producing enough sex hormones, that could also lead to increased risk of osteoporosis. Low sex hormone levels can weaken your bone. Okay, that's the reason why at menopause, woman's body is not able to produce estrogen. That is the highest risk factor of developing osteoporosis after menopause. Men who are undergoing prostate cancer or they are getting treatment for prostate cancer, their testosterone also reduces. Okay, and even women who are getting treatment for breast cancer, they also have reduced estrogen levels. So that can also accelerate their bone loss. Thyroid problems. Too much of thyroid hormone can also lead to bone loss. Okay, especially if your parathyroid hormones are triggered. Okay, parathyroid, if thyroid issue has led to parathyroid imbalance as well, that can also lead to bone loss, and a thyroid that is overactive. Okay, or if you are overdosing yourself with thyroid medicine, if you are on an oral replacement, sorry, hormonal replacement therapy, like you're taking levothyroxine medication, if you're suffering from hypothyroidism and you are taking it more than the required dose of levothyroxine. That can also lead to bone loss. Okay. Then other glands, osteoporosis has also been associated with overactive parathyroid gland and adrenal gland as well. Okay, adrenal glands, kidneys, they also control the levels of calcium in your blood. Okay. And overactive parathyroid hormone specifically works on this region, that parathyroid hormone will signal the blood to take up more calcium away from the bones. So if the parathyroid gland is overactive, unnecessarily more than required calcium mineral is getting taken away from the bone into the blood. Okay. So coming to dietary factors. So far it is clear to all. So it is more likely to occur in people who have low calcium intake. And usually it is very easy to happen, calcium intake, low calcium intake, people who stop having milk or milk products, people who become lactose intolerant in India, and they are not aware of the substitute of milk they should they if they become lactose intolerant, there should be something they're substituting milk with. Okay, just to make sure that their vitamin D and calcium levels are met. So if they're not aware of the substitution, that could also lead to a low calcium diet. Okay, lifelong lack of calcium since childhood. Okay, if you're not having enough calcium, that can also lead to development of osteoporosis. It can diminish your bone density, bone loss, increased risk of fractures can happen. Eating disorders, severely restricting food intake, being underweight also weakens your bone, both in men and women. Anorexia nervosa, bulimia nervosa, these are certain eating disorders. Okay, it's strict dieting and all, crash dieting and all. Women usually go through this 10 days of fasting just to lose that extra kilos. Okay, these are called crash dieting. And other eating disorders, they completely not have food. Okay, so that can also weaken the bone. Gastrointestinal surgeries, gastric bypass surgeries, is usually done to treat obesity, grade 3 obesity and all, in which a part of your stomach or intestine is removed. So you don't have enough area to absorb the nutrients that you're allowed to have, which also includes calcium. So gastric bypass surgery not only puts you at the risk of calcium deficiency, but it also puts you at the risk of other nutritional deficiencies also. Okay. There are quite a lot of frequent cases of indigestion because you don't have enough capacity to mix the food properly, not have enough space to absorb the food properly. Okay. And lot many changes in the diet as well post surgery. So just to help you lose weight and all. Okay, but with that, the risk of deficiencies, osteoporosis can also set in. Some medical problems which can lead to osteoporosis. Okay, underlying medical conditions like celiac disease. It's a malabsorption disease in which the villi, intestinal villi, long finger-like projections in your intestine, is not up to the mark. Okay, the intestinal villi is not able to absorb the food. They are not long, they are short, they are flattened. That is celiac disease. Okay, not just calcium absorption, all the vitamins and mineral absorption will be delayed. Okay, in celiac disease. Then inflammatory bowel disease, people who suffer from IBS, okay, inflammation of your entire intestine, or here and there patches of inflammation throughout your intestine. Okay, so the inflamed part will not function properly. Inflammation will also affect the functioning of that area. So a lot of patches of inflammation in your intestine means that entire area will not able to function properly. And what is the main function of intestine? To absorb nutrients. That function will not take place properly. That will lead to deficiency and other diseases. Kidney or liver disease, in which calcium levels are deteriorated. Okay, calcium, too much of calcium is taken up by the blood, and too much of calcium is getting taken out from the kidney through urination. In kidney diseases, kidneys have the capacity for calcium reuptake. Okay, kidneys try to keep as much as calcium back into the body, not allow it to go out in through urine. Okay, but if kidney, you suffer from some kidney diseases, kidneys will not be able to help in the reuptake of calcium. Okay, so a lot of calcium will be lost through urine as well. So that leads to osteoporosis. Then cancer, even if you are undergoing treatment for cancers, that can also lead to osteoporosis. Multiple myeloma, arthritis, and lifestyle choices. Having a sedentary lifestyle, people who spend a lot of time sitting have higher risk of osteoporosis than people who are more active. And if people are training for weight bearing exercises or activities that lead to weightlifting, okay, or even daily chores that women do at home, okay, in which weight bearing is done, that can also lead to good posture as well as good bones. Walking, running, jumping, dancing, weightlifting, these all are quite good exercises to make sure that your bone density stays well. Multiple myeloma is a disease of your nervous system as well as your bones. Okay. Immature blood cells that are supposed to be getting mature and then released into the blood. Immature blood cells are produced in the bone marrow. Okay. So that is multiple myeloma. Then excessive alcohol consumption or even smoking. Okay, that can also increase the risk of osteoporosis. Tobacco use, either in form of smoking or chewing tobacco. But exact link has not been shown, but there is a contribution of tobacco use and that leading to osteoporosis. Complications, bone breaks, particularly in your spine, hips. Okay, they are the most serious complications of osteoporosis. Hip fractures, and if in hip fractures your blood vessels are involved, that could be uh, lethal as well. Okay, so hip fractures are usually caused by a severe fall. It can lead to disability or even death. Okay, in the first year after injury, because if blood vessels are involved, it can lead to internal hemorrhage. Okay, fracture is not always that your bones break. Even through the bones, there is blood supply. If that blood supply gets shattered or broken, the blood will flow into the bones. It will lead to internal hemorrhage, which is difficult to stop. Okay. And in some cases, broken bones in the spine can even poke you. Okay, and it can lead to collapsing, back pain, losing height, hunched forward posture. Even if you haven't fallen because of your body's own weight and weak bones, it will stoop down. Okay, so your posture and everything changes. So prevention, Men and women between the age of 18 to 50, at least 1000 mg of calcium per day is recommended. And then when they cross 50 years of old age, when in women, assume it as menopausal age. As soon as a woman has hit menopause, she has to increase her calcium intake to 2200. And men after the age of 70, they have to increase the calcium intake, okay, 2200. Also, lactating women, they also have to take 1200 mg of calcium per day. So, good sources of calcium: low fat dairy products, dark green leafy vegetables, sardines and salmon. Okay, salmon is expensive, sardine is more cheaper. So, people who are in the coastal areas, and sardine is easily available as well. Only apart from certain trawling seasons, but other all the other seasons, sardines are mackerels and sardines are available. Okay, soy products like tofu, all form of soy products, soy milk, uh, soybean, okay, tofu, tempeh. Then calcium fortified cereals, orange juices, even milk. Milk also comes fortified in calcium, vitamin A, vitamin D. Atta as well, certain attas that you get, flour that you can get from supermarkets. Some of them are calcium fortified. Vitamin D, it improves your body's ability to absorb calcium, improve your bone health. People can get some of their vitamin D from sunlight, but that is not a best source. Okay, if you are living in a hilly region, mountainous region, geographically you are situated in an area where you don't get enough sunlight. Okay, so in that case, that's not an ideal way of getting vitamin D. Or if you are inside your house, even if you are in the tropical areas, but you are inside your home, inside your office, okay, so you're not being exposed to sunlight much, that could also lead to osteoporosis. Okay. Vitamin D is important for calcium absorption, maintenance of calcium, maintenance of your bone density. Too much of sunscreen can also block vitamin D absorption. Exercise can help you build strong bones, especially weightlifting, strength training exercises. Whenever you start, there is no specific age to start exercising. Whenever you start, from that moment onwards, your bones become stronger. Your bones are able to retain more calcium, not lose it. Okay. But when you are young, the benefit that you get from exercise, that will stay long throughout your life. Then treatment recommendations are often based on an estimate of your risk of breaking the bone. Okay, so this estimate is done on your bone density. Okay, DEXA scan can be taken. Bone density test, that is a DEXA scan. Dual energy X-ray absorptiometry, that is the full form of DEXA. DEXA scan can show you your bone density, okay, based on your family history, your diet, your lifestyle. These can be used to understand what is the risk of developing osteoporosis, okay. And these are the medications usually given: biphosphonate combinations, hormonal replacement therapy if you are in menopause, hormonal replacement therapy. If you are having thyroid problem, again, HRT therapy is given. HRT means hormonal replacement therapy. Bone building medicines, usually calcium supplements and all, is given. So that's about osteoporosis.